Heartbeat Podcast, a podcast about health, politics, and society. Heartbeat Podcast Episode 7 will look at the rising number of COVID 19 diagnoses in Namibia. We know that one of the key elements to a public health response is contact tracing. That is, finding all individuals who may have been exposed to a person who tests positive for COVID 19. What usually happens is that you will receive a call from the Ministry of Health and they'll tell you that someone has tested positive for COVID 19, but they'll not tell you who that person is. They'll then ask you to confirm whether you were at this place at that time while protecting the identity of the newly diagnosed case. And then you may be asked to enter quarantine. So in this episode, we'll delve into this with epidemiologist Blake Hendrickson, who is in the United States of America. Stay tuned for this. We will now turn to our Word on the Street segment, which this week comes via WhatsApp voice note. We no longer go to the streets to collect these voice notes because we want to observe social distancing. So let's listen to what our listener has to say about contact tracing.
Hi, it's Helene here. Just to answer your questions. So, how has the contact tracing been? So I got my results only yesterday, but today they called me. Someone from the ministry called me to ask about my context, and I think it has been easy for me because I started experiencing my symptoms on the 31st of July. That's the it was on a Friday. I was traveling to Sources Flay. I was sneezing a lot, but I assumed it's probably just an allergy, and it got worse over the weekend because I was nauseous, and I lost my appetite completely. But I was drinking alcohol, and alcohol does that to me. It makes me tired. So I was drinking alcohol. I went over the dunes on Saturday, and I was really tired after that. But even when I was not feeling well after that, I just rested. I slept, and I was really tired, and I had a lot of muscle ache. And I assumed it's probably just because of the activities that I was doing. I have given my contacts from the Thursday because Thursday I left Windhoek to go to Rehoboth. I slept over at my sister's place. I gave their contacts. I gave the contacts of the people I traveled with, and then on Monday morning, I got back on Sunday. So Monday morning I was really not feeling well, so I decided I'm just going to. I lost my sense of taste and smelling. So I immediately went to the clinic, Robert Mugabe Clinic, to go get tested. The testing period process was not really hard because immediately when I told them my symptoms, they ask you if you have any contact with any person that has been that's a confirmed case, and I didn't have any, not any that I know of. And then they asked my symptoms, and as soon as I said I lost my sense of taste and smell, they said get in. And the challenge there, I think, was just the admin work. They had to fill in two papers. One I came with, the other one is from, I guess, from their own use. That took a bit of a while. I think that was taking a bit of a while. The process of the swabbing and stuff, that doesn't take long. It's quite fast. I was quite satisfied with the service I received. But hearing from the people now who went yesterday and today, they're saying it's slow. And I can understand it's because of the workload now. But at the time when I went, I don't think the workload was a lot. The challenge, however, after that was that it took 7 day, a whole week, because I tested last week Monday and I got yesterday my results yesterday. It took a whole week, and between that time I was sick, like really weak, and still uncertain if it's really So my challenge was, I'm uncertain if it's really coronavirus or is it something that's actually much more serious.
Welcome back to Heartbeat Podcast. That was our listener's contribution. Now we will turn to our main interview with epidemiologist Blake Hendrickson after this. Thank you for staying tuned. We will now turn to Blake Hendrickson, who will explain to us what contact tracing is and where it's used. Good day, Heartbeat Podcast listeners. Today I'm very privileged to be joined by Blake Hendrickson, who is an epidemiologist in the United States, specifically in the state of Nebraska. He's in the state capital, Lincoln. Welcome, Blake.
Pancho, good hearing from you. Thanks for having me.
So, Blake, what is your connection to Africa?
Well, we went to grad school together about 5 years ago down in Cape Town, and my wife is from Cape Town. I've lived in the Western Cape of South Africa on 2 different occasions. So I'm married into South Africa, and really just have a lot of family and friends in that area now, and that includes yourself.
Oh, thank you. Well, as you know, I'm in Namibia. We broke away from South Africa over 30 years ago, but that's okay.
Neighbors, yes.
I wanted to just say thank you so much for joining us. In Namibia now, we have really experienced a dramatic rise in number of deaths. Yesterday, we registered 3 deaths, which is a record for our country in 24 hours. And in total, we have 2,652 confirmed cases. And we've got 15 deaths in total. So can you please tell us a little bit what you do and what would you make of those figures?
Yeah, that's a good question. And, Namibia is somewhat similar to my state of Nebraska. Nebraska's right in the middle of the United States. It's kind of mostly rural, some small cities, I would say, and it has about 2 million population as well. So it's it's kind of comparable there. We have a lot more cases than Namibia does. There's a lot of travel within the United States. I don't think that we've done as good of a job with some of the tools we have at our disposal with COVID. So on one sense, I'd say Namibia is relatively in good shape. But on the other, there's always things that countries and communities can do to be proactive to try to keep the numbers down, because they will go up and down over time, and COVID's not going to go away anytime soon.
Wow. So when we feel this sort of anger towards the health authorities, what would you say? Because you work on the ground doing actual contact tracing. Is that correct? Or do you look at the bigger picture?
Yeah. So my role with our state health department is to make sure that everyone that's testing positive is informed about it, that we do an interview to see how they're doing, and do the contact tracing to see who was around them and who should be quarantined to try to stop the spread of that. So every country and every government is in this kind of new realm of doing this mass contact tracing effort. And, the testing and providing personal protective equipment for healthcare workers, it's a pretty unprecedented challenge. And there's a lot of things that we need to do, but aren't always easy to get done in a timely manner. And every government, has a tall order to continue to provide those services during a pandemic.
So we wanted to ask you in Namibia, what is it actually, now that you have many more cases, what are some of the things that we should try and anticipate, since we're so similar to the state of Nebraska?
In one way, now we know a lot more about the virus. So that makes it easier than what we were dealing with in, early 2020 when we were kind of dealing with an unknown enemy, so to speak, and we had to develop a test on the fly and all these things. The first real critical requirement from governments is just to make sure that testing is widely available. Because if you don't have tests there, you're basically fighting this blind. You don't know when it gets into a new community. You don't know when it's going to overwhelm a healthcare system. There's generally a 1 to 2 week lag between when you see a spike in the number of positive cases in an area and when you can count on a spike in how many people are hospitalized and then subsequently, more people dying. So you really need that early indicator of where the cases are and when it starts getting worse.
Yeah. And what does contact tracing actually entail? Because I don't think many of our listeners understand. Could you please explain it? And we've also heard the second question from the CDC here, your Centers of Disease Control and Prevention, that at a certain point when there's so much community transmission, contact tracing actually is no longer necessary. Can you please explain that?
Yeah, good point. Contact tracing is kind of a tried and true foundation of public health. It goes back to tuberculosis and syphilis and other infectious diseases, and essentially it's identifying people with a certain disease that could spread it to others, figuring out where they've been and who they've been around, and finding the people that may have been exposed and could be the next generation of cases, and getting a hold of them before they start having symptoms or before they do spread it to others, and providing some intervention. And in the case of COVID, we really need people to quarantine even when they're still feeling, maybe healthy, because it can take a couple weeks between when someone is exposed to the virus and when they start becoming ill. So if they're already home during that time, then there's much less likelihood that they're going to be out and about at the grocery store with family spreading the virus before they even know that they have it. So the contact tracing is really trying to be proactive and get ahead of the virus, and it's what we call chain of transmission to slow it down.
And the question,
and it's true that you asked about at what point is it still valuable. And, it would certainly make my life a lot easier if we didn't have to do it on 200, 300 cases that we have every single day in Nebraska. We've got 70,000 cases per day in the United States right now. COVID is flying around like the rain, and it's really challenging to do activities like contact tracing, and it requires making phone calls to all these cases and their contacts. Sometimes people don't want to answer. Sometimes people aren't available. They might be in the hospital. So it is a challenging task. And at a certain point, when it's so widespread, it doesn't provide as much value as when you're trying, like in New Zealand, when you only have a couple cases and you can put a lot of time and effort into each specific case. That's when, eliminating a disease, contact tracing is particularly helpful. But yeah, we certainly can't leave any countries behind when it comes to the supplies they need, or the information they need, or just assistance they need. And, I think a lot of countries are really preoccupied with their own responses, but we do need to take a larger look at this and know that we're all dealing with the same situation. And anything, that is, we might get it under control in a certain country, but if your neighbor or some other country isn't able to do that, it's still a threat to everyone else. So that's always an infectious disease principle that we have to keep in mind.
And I think just to ask you, of course, the question on everyone's mind is, given what is the burden in South Africa, it's really way over 500,000 cases. I mean, and they have 50 million people, but they have quite a large number of cases. I think they have about 5,000 per million population, if I'm not correct. Do you ever think you'll be able to travel back to South Africa? When would we expect to see travel resume, or you have no idea?
Great question. I am hopeful that I will get back to South Africa. I've been away for 5 years, so we were hoping to actually be there this Christmas, and that's not going to happen with COVID. But just looking back at how previous viral pandemics have played out, it does take a year or two of pretty strong, widespread viral activity worldwide before it kind of slows down a bit. And
Right.
again, COVID's not going to go away, but it's going to slow down at a point where a lot of people have been infected, and or we have a lot of people who have been successfully vaccinated. So that takes some time, and eventually COVID will become like what we see with influenza, or the common cold, or pertussis, these other seasonal pathogens that we just have to deal with and live alongside. But when a new virus comes about into the human population, it can really spread like wildfire until it circulates widely. So I'm really hopeful that after a year or two, things calm down with COVID. We might have a vaccine that helps with that, and that
Exactly.
we can all get closer to a sense of normal, living alongside COVID instead of where we're at right now.
So, from me, Pancho Mulongeni, I wish you and your South African American family an amazing day. Please stay safe there. And
Thank you,
thank you.
Pancho. Yeah, it's been great chatting with you. I love hearing about what's going on in South Africa and Namibia, and I really hope the tides turn for the better as it comes to COVID and the economy and everything else going on around 2020. It's been a challenging year for everyone.
Thank you so much, Blake Hendrickson.
We'll talk to you later, Pancho.
That brings to an end episode 7 of Heartbeat Podcast. Thank you so much, listeners, for tuning in. And let us hope that the Ministry of Health and Social Services does not have to call you to mention that someone who has been in contact with you has been diagnosed with COVID-19. But if they do, please be cooperative. Let us all work together to make sure that there are no more COVID-19 cases in Namibia. Pancho Mulongeni, signing off.